Good afternoon, welcome back. It's my pleasure to welcome the Honourable Dustin Duncan, Minister of Health, to the Spring Representative Assembly. Mr. Duncan was first elected as MLA for the constituency of Weyburn-Big Muddy in June 2006 at the age of 26. He was re-elected in 2007, and Minister Duncan served as chair of the Standing Committee on Crown and Central Agencies prior to entering the cabinet. In May 2009, Premier Wall appointed Minister Duncan to the Saskatchewan Cabinet as Minister of Tourism, Parks, Culture and Sport. Appointed 2 months before his 30th birthday, Minister Duncan is the youngest cabinet minister in Saskatchewan history and one of the youngest in Canadian history. In June 2010, Minister Duncan was appointed as the Minister of Environment, Minister responsible for Saskatchewan Water Corporation, and Minister responsible for Sask Energy. On May 25th, 2012, Minister Duncan was appointed as Minister of Health. The SMA Board of Directors had the pleasure of meeting with Minister Duncan and Minister Weeks for the first time prior to the Fall RA in 2012. Since that time, we have had several opportunities to bend his ear. Minister Duncan is active in his community and is a past board member of the Family Place, a community-funded, community-driven resource centre for families in Weyburn and the surrounding area. Minister Duncan and his wife Amanda, a musician, make Weyburn their home. Please join me in welcoming the Honourable Dustin Duncan.
I'll introduce a couple of members of his team. There's Deputy Dan Florizone here, and Max Hendricks as well as also part of the team. Welcome.
Good afternoon, and thank you very much. I'm very pleased to be here at the Spring Representative Assembly, and I apologize for the delay in getting here this afternoon. I want to first begin by expressing my thanks to Dr. Shannon for her introduction, as well as to you, Dr. Shannon, and Dr. Vino Patiacci for the invitation to join not only you this afternoon, but also yesterday afternoon at the board meeting. And I also want to thank you for the leadership that you have shown in your time as president of the SMA. I also want to welcome Dr. Clara Kozrowski, who will be serving going forward as the president of the SMA, and I look forward to working with you, Dr. Claire, over your term as president. During the past few years, we've seen tremendous change and progress in our healthcare system, and in the relationship between the Ministry of Health and the Saskatchewan Medical Association. We share the same goals: a strong commitment to putting the patient first and continuous improvement in our healthcare system. And we are so very fortunate to have such skilled and experienced and compassionate physicians here in Saskatchewan. The SMA is an important partner, is a critical partner in bringing about transformational change that we are seeing and that we are working towards, and that we have seen many successes together, and you have played an important role in that. We have added over 270 physicians since this government took office in 2007, but we know that there are still improvements to make in recruitment and retention, and many new doctors are needed in our province. Our physician strategy includes initiatives that touch on different aspects that are necessary to this. SAS Docs to provide recruitment efforts across this province, this country, and around the world. Our Rural Physician Incentive Program to provide $120,000 in funding not tied to student loans, but $120,000 in funding to recent family medicine graduates who establish practice in rural communities. And our Physician Locum Program to stabilize physician services in rural areas throughout the province to complement the SMA program. As well as the SIPA assessment, which accepts physician applications from a wider range of countries, and as well our distributed medical education program that trains physicians in practice in rural Saskatchewan, a program that exposes aspiring physicians to rural medicine practice requirements and expectations, while acquainting them with life outside of our larger centers. Towards the same goal, it's just as important to keep the physicians that we already have here. That's why we focus on making sure that we offer doctors competitive compensation and an attractive workplace environment. Saskatchewan has one of the best physician compensation rates and physician retention rates in Canada, and we look to keep that. Physician numbers are starting to turn around. I'm pleased to say that the province's overall supply of doctors has been steadily increasing. More than 2,000 physicians are currently working in the province. This represents an increase of nearly 18% from March of 2007 to March of this year. We've seen other big improvements as well. For example, wait times for surgeries are shorter in Saskatchewan. Our surgical initiative has faced challenges, but it has made remarkable progress. With support from all of our health system providers and partners, we set a goal of making sure that all Saskatchewan residents are offered necessary surgery in less than 3 months by April 2014. And we know that there's still more work to do on this. We're also focusing on strengthening our primary healthcare system. Since we launched our primary healthcare framework last year, our 8 innovation sites have been testing new approaches to primary healthcare delivery. These innovative sites will make better use of a full range of health professionals working to a full scope of practice with a physician as a key team member. What they learn will be applied in other communities across this province. Working on a team with other health providers is designed to give physicians a better work-life balance, reduce stress, reduce burnout, and ultimately turnover. Physicians have been consulted and have been vital to develop this framework. It's also exciting to see the potential of what we learned from Nova Scotia with their collaborative emergency centers and as we consider how they could be a part of our primary health care in rural and remote areas of the province. We expect that Maidstone, Shaunavon, and Leader to be the first communities to introduce CECs in the coming months. Improving the predictability of services and access to care for patients is our goal. We hope that this model will also improve the quality of life for our rural physicians by alleviating their often rigorous on-call schedules. The key to all of these initiatives and to a high-performing health system is physician engagement. And we had a great discussion yesterday at the board meeting about this topic. It's no coincidence that everything that we're doing involves consultation and collaboration with physicians. And where this doesn't happen, I expect you to call us on it. I feel very strongly about this. Simply put, nothing happens in the health system without physician involvement and leadership. Your influence helps to develop and advance successful new initiatives, demonstrated time and time again through lean projects and other inspiring results. Our government is committed to improving access to a health system that provides better health, better care, better value, and better teams. And I know that this is a commitment shared by the SMA and by individual doctors in this province. This year, there are 3 system-wide improvement areas that we are working on. Surgical wait times will continue to be front and center. Again, with the goal by 2014, nobody waiting longer than 3 months for surgery. And we know that this goal, and working towards this goal, will extend into 2015 in at least one region in this province. But ultimately, it's not just about getting to 3 months, it's making sure that we stay there once we are there. Primary healthcare innovations are becoming well established, and we're getting ready to spread local and community successes across the province. And I expect exciting developments in this area in the coming months. And finally, building a culture of safety is tremendously important in putting the patient first, both as it relates to the patient and also to our providers. Beyond those system priorities, rural family physician stabilization is one of the ministry's focuses. We look forward to working with the SMA more in the coming year on this strategic priority. I am especially pleased to count on Randy Weeks, the Minister of Rural and Remote Health, who sends his regrets he couldn't be here this afternoon. Minister Weeks is helping us tackle these and other issues as they relate to rural and remote access for healthcare. And as many of you will know, Minister Weeks visited more than 40 communities last summer to hear from physicians and other providers and community leaders. And he has more visits planned this summer. Without the involvement of engaged physicians and authentic engagement on both sides, we couldn't and we cannot transform Saskatchewan's healthcare system into one that is truly patient-centered and a model for others. The nation is watching and encouraged by the improvements and the initiatives that we've started in Saskatchewan. Your leadership, your example, and your support is so important as our entire healthcare system undergoes significant changes. This work cannot continue or be sustained without your involvement and your leadership. Your conference theme of advancing physician leadership shows that we're thinking very much along the same lines. No question there are challenges ahead, but we've seen incredible progress and improvement as our entire healthcare system undergoes significant changes. On behalf of the Government of Saskatchewan, thank you for your involvement, for your leadership, your continued leadership, and for having me here this afternoon. Thank you.
Thank you for those comments. We'll now field some questions. Oh, go ahead, Dr. Claire Kozrowski.
Minister Duncan. Didn't mean to call on you that way. On behalf of the SMA, I would like to thank you for speaking today and for meeting with the Board of Directors yesterday.